First Minister, as you're aware, Hywel University Health Board held a public consultation over the summer regarding its plans for clinical services within the Health Board area. Throughout the process, I have made it clear that I do not support any proposals that result in the removal of services from Withybush Hospital. And I'm particularly concerned about the potential impact of some of the proposals, such as the possible removal of the intensive care unit and emergency general surgery services. I firmly believe that the people of Pembrokeshire should not have to travel further to access essential healthcare services. And my constituents have made it very clear that they oppose the Health Board's continued downgrading and centralisation of services. Now, First Minister, you also represent the people of Pembrokeshire, and I therefore urge you to oppose any plans that would take services away from the people that we represent. And so can you tell us what discussions you've had with Hywel University Health Board about its clinical services plan, and what reassurances can you offer the people of Pembrokeshire that they will not have to travel further for essential services in the future?
Well, thanks very much. And I know the Health Board is developing its clinical services plan, and that aims to drive improvement, particularly in service fragility. We've got some services where they are utterly dependent on one particular consultant. We need to look at sustainability and quality and performance. Now, what I understand is that people feel very strongly about their local health services. I have clearly made representations in my capacity as a regional member to the chair of the board, but no decision has been made by Hywel University Health Board about the future of identified services in its clinical services plan. I think what we must focus on is sustainability and outcomes. What are the best outcomes we can expect for the public?